Welcome everybody to a new episode with Astrid, your APD, your dietitian with T, no C. And today I have this beautiful girl in front of me, Kumkum Patel, and I wanted to have her on because she's best known as the gut motility doctor. So I want to ask a lot of questions about everything that has to do with gut health, constipation, diarrhea, IBS, microbiome. So let's get deep into these topics. Why do you do what you do, and why gut motility? Why gut health?
I'm a board certified gastroenterologist, and throughout my training, I realized that there is so much having to do with the gut brain axis, so much of the GI tract, how it moves, and how we respond to stressors and every day has to do with our relation from our gut to our brain. Not only that, when I was training to become a gastroenterologist myself, I became a first-time mother, and I actually experienced a lot of IBS symptoms with changes in my own hormones. As a new mom, I experienced, postpartum depression. I had pelvic floor dysfunction, for which I had to get pelvic floor physical therapy. And so I realized that there are a lot of patients out there who are experiencing the same things, but are not getting the relief because they don't have someone who's trained in this area of GI to be able to treat them properly and to diagnose them properly. So that's why I did a motility fellowship to learn about IBS disorders, bloating disorders, how the muscles in the intestines move, and how the pelvic floor is related to IBS type C. And that's where I decided that this is where I can best serve my patients.
I love to hear more about everything that you have to say about so many topics. So after talking and looking at your content and just talking to a lot of my patients and clients, I know that IBS is a big issue, and unfortunately it's not necessarily a diagnosis as a condition as such, because it's so variable for different individuals, and it has so many different presentations. I would love for us to talk about IBS, what it is, what are the different types that we find clinically, and basically, what would you consider is the best way to approach or manage this in not just with diet per se, but all these other different triggers that can affect IBS flares?
Absolutely. So, irritable bowel syndrome, that's what IBS stands for, is a disorder of gut-brain interaction. So the foundation that actually defines it is calling it a disorder of gut-brain interaction because we understand that our gut and our brain is very intimately connected. Our gut is actually considered the second brain, and the nerves in our gut are considered the second brain. It's the enteric nervous system. And the enteric nervous system relies on the bacteria in our gut to make something called neurotransmitters, which are the happy hormones, the satiety hormones. And by helping to make these neurotransmitters by producing something called short chain fatty acids, they are able to send then these neurotransmitters to the brain to help with mood, setting mood. It can help us to understand how we feel full. It helps us to understand weight sensitivity, insulin sensitivity. So it's very intimately connected. When you have things that disrupt the gut microbiome, which is the bacteria in our gut, that can lead to a change in the bacteria. Then the bacteria are not able to make a lot of these good, neurotransmitters, and it can also cause stress or anxiety. That affects the brain. So when the brain is under distress and it's got psychological distressors, that can alter how our intestines perceive pain, how our intestines perceive movement, and that alters motility. So it can say, okay, we are in a state of so much stress that we are in like a low dose fight or flight. So the intestines for some people speed up because they're trying to get emptied And so you see a presentation where the person has a lot of diarrhea and a lot of bloating because the intestines are in a state of fight or flight and they're emptying out their bowels to get rid of it in order to prepare for whatever stressor it is. In other people, they get constipated because their bodies are under tremendous stress and the body is saying, no, we can't poop right now until we are relaxed enough to go to the bathroom. And that's very common for people. You see, they go on an international flight and they don't poop while they're on vacation because this is not their normal toilet, right? And so until they come back to their home toilet, they are constipated for the entire time that they've gone abroad. And so that is when the nerves are basically frozen in time and they say, no, we are not relaxed. We're going to hold on to the poop and, only let it loose when it comes home. So that's IBS type C, where there's constipation involved. And again, these are disorders of gut-brain interaction because the brain is being told that there's some type of underlying distressor, and the gut is then subsequently responding to that stressor.
And when we think about the different types, I believe it is about 4 types. So which one is the most common in your practice, and what do you feel like is the most complicated one to manage?
So there's IBS type C, which is IBS with constipation. There's IBS type D, which is IBS with diarrhea. There's IBS type M, which is mixed, which means that sometimes you have diarrhea, sometimes you have constipation. And then there's just IBS of unknown significance. But that last one is not usually defined. It's usually those top 3 that are main ones that we talk about. And the most common one that I see in my practice is IBS type C, which again, a lot of women have this. And we see it also with pelvic floor dysfunction. So stress along with the pelvic floor muscles not working well together, combination of the two, they can exacerbate one another, and you see a lot of IBS type C.
When I hear about dieting, stress, low energy availability, maybe it's a bit of a separate question, but it kind of goes back to those who suffer from IBS. There's like a big correlation with like energy availability, serotonin present, production, and digestion. What is your take on this scenario? I do work a lot with like physique athletes. I am an physique athlete myself, and I am doing my first bodybuilding contest prep, and I've realized that my digestion, when I started eating less and obviously training more, there was more stress in my body. Like I would be so bloated, sluggish in terms of like my digestion, and even like having a complete total habit and bowel movement change. Like I was usually very regular and now like suffering from constipation and usually struggling a lot with that, even if I still eat the same things, the same foods, the same hydration. Like there's nothing different, but just obviously a little bit less calories, but I'm still eating quite a decent amount of fiber. So we're talking about 35 up to 45, 50 grams of fiber a day. But it's just like the bowel doesn't seem that it wants to cooperate. So what is your take on this specific situation?
Yeah. So serotonin is predominantly made in the gut, right? More than 80% of our serotonin, which is our happy hormone, is made in the gut. And not only is serotonin involved in setting mood in terms of stress, in terms of happiness, but serotonin also modulates how our intestines move or how they empty. So if you've got a lot of stress, if you've got a lot of psychological stress, our serotonin is being depleted, right? And when you have a low amount of serotonin, you're not able to modulate good forward kinetic movement in the intestines. So of course, the intestines then slow down, right? So you think about even some of the medications that are out there currently for IBS type C. There's one called prucalopride, which is a serotonin agonist. We're actually trying to get to the receptors that are triggering serotonin and the production of serotonin to move poop forward. So it's no wonder that in IBS type C, having a low serotonin or high amounts of stress that is depleting your serotonin is going to lead to a sluggish bowel that is not moving things forward. And just like I had mentioned, if your body or your brain is under distress, whether it's you're training for a major athletic event or you're about to give a huge presentation to your job, your body's under stress. And so when it depletes that serotonin, your body goes into almost like a freeze mode. And it says, no, until we're done with the stressor and until we've done dealing with the stressor, we can't move things along and be relaxed enough to move things along. And so that's why it's important to replenish the serotonin through fiber, through sunshine, through good sleep, to allow our bodies to make that serotonin on its own. And sometimes if you can't do that on its own, even with diet, we have medications like sertraline, which helps to replenish it by taking it in a pill form, or using medications that allow for the serotonin to be released in our own bodies to allow for constipation to be relieved.
I heard one time that the blood-brain barrier doesn't seem to be compatible to allow the serotonin made from the gut with the same easiness as it would be the one that the same brain creates on its own. How true this is, and how does this impact how serotonin made in the gut gets to the brain?
So yes, that is true. I mean, not all of it can get through the blood-brain barrier, but you do have a high amount of it being produced in the gut and traveling to the neurotransmitters through the vagus nerve. So a high amount does, and that's recommend that is produced in the brain. The central nervous system also gets released such that your brain also has the happy hormones up here to let the rest of the gut know that it's also feeling less distressed. Not all of the serotonin made in the gut can actually go up to the brain. And so that's why we recommend for the brain to see sunshine so that the melanocytes, in our brain and in our skin can allow the release of serotonin. And so that your brain can at least release that and set the mood so that it can communicate back to the gut that it is in a happy state.
In this regard, when the serotonin produced by your gut is not necessarily entering the brain, what is the role of this serotonin? Where does this extra serotonin made in the gut act?
It acts on the actual enterochromaffin cells in the intestinal cells so that it modulates the actual movement of the poop and on the intestinal cells themselves in the small bowel as well as the large bowel.
And does this serotonin has an impact in other parts of your body that has nothing to do with the gut per se?
To some degree, I'm sure it does, but I'm not as confident on that, and well versed in order to be able to answer that confidently.
That's okay. When we think about the management of IBS, what are your top 4 or top 3 recommendations when it comes to truly get to a place where IBS is truly no longer a issue that affects quality of life?
So first things first is being upfront with your physician about what your triggers are and what your symptoms are. If it is constipation that you have, understand that if you have a stressful life, you need to be upfront with your doctor so that they can figure out what your triggers are for your IBS. If it's traveling, if it's a stressful work life, if it's a relationship, if it's trauma, if it's something in the past, all these things need to be addressed, because if you're just addressing the gut in the gut-brain axis, but you're not fixing the underlying cause for the brain to be under distress, then you haven't fixed your IBS in the first place. That's number 1. Number 2, if your medications that are prescribed for your IBS, whether it's plecanatide for IBS type C or Xifaxan for IBS type D, it doesn't matter. That may not be sufficient because there may be an overlapping symptom or overlapping syndrome that's associated with IBS. So in that sense, if you have IBS type C, a lot of people, over 60% of them, also have pelvic floor dysfunction, where their muscles in their pelvic floor have been so used to having constipation for so long that they no longer coordinate properly to allow it to relax to let the poop out. And so they often might be only opening partially or opening, not to a sufficient amount, or if you've had trauma, not opening well at all. So sometimes getting pelvic floor physical therapy may help. In other times, getting an antidepressant like sertraline or Zoloft here in the United States can help to allow that person to relax, get the brain to say, okay, we're finally in a happier place, to allow the body to release those nerves so it can move the actual bowels along. So it may be a multifactorial thing, and you have to be very honest with your doctor upfront so that all of those aspects can be addressed.
Is there anything in terms of lifestyle management that you recommend beyond the medications and the being upfront with your doctor? So what can you do on your home, at home, on a daily basis that will contribute to improve the management of IBS?
Absolutely. So eating fiber every single day, at least 25 to 38 grams of fiber a day. If you're seeing natural light every single day, that can help to hit the circadian rhythm in your body and say, okay, it is now daytime. It is time for us to release, serotonin or awakening. And this allows our bodies to be able to regulate themselves. Number 3 is exercise. Whether it's a short form in terms of walking, which allows our bowels to stay moving also, or if it's resistance exercise, because this can help for our bodies and our muscles to actually generate those short chain fatty acids themselves. The same things that we are asking our probiotic bacteria to do, exercise also helps produce those short chain fatty acids. So it's very important to get it. And you don't have to be an athlete. You can at least get 20 to 30 minutes of walking every single day for you to get some type of movement through your body to help allow your body to make that short chain fatty acid. And the more resistance training you can do, the more you can help your muscles become insulin sensitive and allow for them to be able to help in terms of having satiety and producing those short chain fatty acids.
You mentioned something that is interesting. Are there any forms or particular forms of exercise that would be better to improve that gut motility versus others? Like, let's say jumping or some like high impact will help that movement, or the intensity or the form of exercise would have a different impact on how your gut responds if the constipation is the problem.
So as long as you have aerobic activity, it doesn't have to be anaerobic activity. Aerobic activity where you're, using up oxygen, that helps with the motility of the gut and allows for certain probiotic bacteria to start to kind of build up more specifically like bifidobacterium. And that helps that bacteria to make more short chain fatty acids.
I hear something that comes from like the carnivore community all the time that talks about why actually having more fiber is worse for your constipation, because it seems like you're putting more trucks on the road rather than taking them out of the road. So what is your take on the type of fibers, because we know not all fibers are the same, and what is the role of fiber in the improvement in gut motility, and how can we make the best use when it comes to this fiber? What are the best options when you do have constipation to go for?
Absolutely. So when if you're taking soluble fiber, that is what is used when you eat it, it forms a gel-like substance. Okay. So when it makes a gel-like substance and it lines the lining of your intestines, it helps to reduce absorption of sugars and carbohydrates. But that can actually slow down the intestinal motility. So in persons who have diarrhea, that's helpful. For a person who has constipation, that's not. The person who has constipation needs more insoluble fibers, because insoluble fibers, you think about your rough veggies, your bran, cereals, things like that. That is what is speeding up the transit time and causing for poop to come out faster. Okay, so there's a difference between soluble fibers and insoluble fibers. And the insoluble ones are the ones that are, you think of your rough veggies, your kale, your broccoli, your bran. Those are the ones that are speeding up the transit, so speeding up for the poop to come out, helpful in constipation. But it's the soluble fibers like your berries and your chia seeds that can sometimes slow down motility, especially when it's forming that gel-like substance and preventing overabsorption.
So back to my kind of like the analogy that I hear all the time. Okay, so we're putting more trucks on the road because insoluble fiber is obviously not digested. It's not going to form any gel. It's actually going to put more pressure and like increase the traffic. So how does that help in the actual gut motility, like your gut to understand we need to move?
It will help by feeding the probiotic bacteria that need that prebiotic fiber to produce the short chain fatty acids, which will then help to make the serotonin, which will help to modulate the emptying of the bowels.
Interesting. Because
so it's a downstream effect.
Yeah. What could be another issue or another cause for constipation when it's not necessarily IBS the problem?
So certainly, if it's not IBS, that's the problem. It can be a variety of things. It can be there's a hormonal disorder. If you have hypothyroidism, if you have hypercalcemia, if you've got diabetes, if you're taking one of the new meds for weight loss like Ozempic or Wagovi, right? These are the GLP-1 medications. They slow down the intestinal motility. They have something called the ileal brake phenomenon, where it slows down how fast the intestines empty. So by doing that, that can certainly cause constipation, because if you're not emptying out your intestines, it's slowing it down. So it makes you feel full, so you're not eating as much. So one of those medications can certainly cause it. The other thing is it could be pelvic floor dysfunction, because it's not just about how the intestines are moving, but what happens when the poop is actually getting to the end of the tunnel. Is the exit actually open, right? If the exit is not open, then everything is stuck anyways, right? And people who've got pelvic floor dysfunction, if the rectal muscles are not relaxing to let the poop out, and if they're staying closed or they're only partially opening, it doesn't matter how much the intestines are actually moving. If the exit is not opening, if the door is not opening, everything is still kind of stuck. So that's an outlet dysfunction or pelvic floor dysfunction.
What about people who have, like, when they're pooping, they actually get intestinal prolapse? So you actually feel like part of your rectum comes out. And this might not even be painful to certain people, but is that a sign of issues with your pelvic floor? Or what is the relationship between that prolapse and that pelvic floor?
Yes, absolutely. So your pelvic floor muscles are there, and we have three main muscles called that form something called the levator ani, right? Levator meaning lifting up, ani meaning relating to the anus. So they're keeping your whole bottom lifted. And when these muscles get weak, they can allow for something called pelvic organ prolapse. So your rectum, your uterus, part of the bladder can become weak, and they're no longer held up because they've gotten weaker. So let's say you have a very heavy pregnancy with a heavy baby. Now the pelvic floor muscles are so weak, now they allow for things like the rectum or the uterus to kind of prolapse out, especially when you're pushing. And so you can see the prolapse happening either through the vagina, or it can even happen through the rectum itself when you're pushing so hard that your pelvic floor muscles are not able to keep them in.
How do you deal with that if that has nothing to do with necessarily pregnancies? Like, I have met patients they never had pregnancy, actually were men, or like females that have never had a baby in their life, but they experience an anal prolapse.
So with that, usually you'd have to get surgical repair, or you can even do pelvic floor physical therapy that can help to train those muscles on how to contract, how to strengthen, and how to, not over push. So it also helps with core muscles. They work on that with you as well. So doing pelvic floor physical therapy can be extremely helpful in patients who have that, but sometimes that's not sufficient. And so those patients need a surgical repair.
When we look at patients, obviously every person will have like their own unique bowel habit movement that is going to be normal, quote unquote, normal for them. And I kind of came about this question because when I am in the hospital and I am reviewing the patient's chart, for some patients, I get to see that they never open the bowels, but every 3 days. But for them, perhaps that's their normal. When I ask them, is this your normal at home? And they say, yes, this is my usual normal. But for other people, they open the bowels every day, and just not having opened the bowels on 2 days, they are already concerned. So what is normal when it comes to bowel movement, opening bowels in a person's life, when we should be concerned?
Everyone's normal is different. You're absolutely right. And normal can vary anywhere from 3 times a day to once every 3 days. And it's what is normal for you. So if you feel like when you've had a bowel movement once every 3 days, that you feel completely empty and you feel like you've completely evacuated and you don't feel like anything is left behind, then that's fine. And if you're comfortable and you're not having a sensation that you're full or that you still need to go, then that's fine. If you need to go 3 times to feel that complete evacuation, like you've emptied your bowels, and it takes up to 3 times a day to do that, that's also normal. It's uncomfortable or abnormal when this strays from your normal patterns, okay? Your typical patterns. So if you are typically going 3 times a day and now you're only going once a day, that can be constipation for you. And not just the frequency, but it's what else comes with it. Does it look like small milk duds? Does it look like a, hard rock? Does it feel like you're having to push very hard? Is it lumpy? Is it you're having to strain? Those things along with it are what define the constipation, not just the frequency.
What about diarrhea? Because I kind of like face the same situation in hospital as well. I do see patients that just suddenly they have a loose bowel and they think they are half diarrhea, and they're super scared. And on the other hand, if you have a few bowel movements that are loose, that could still not be necessarily diarrhea itself. So how do we define diarrhea, and what's normal when shall be concerned?
And again, diarrhea is one of those things that is also subjective, right? If you normally have loose stools and this is your abnormal, that's when it's really considered diarrhea. But it also has to do with the consistency of the poop itself. So if you're having water or you're having, something that looks like soft serve coming out, that's technically considered diarrhea or loose stools. And it's the frequency that is making it diarrhea, not just the character. So if you're having it more than 3 times, and it's coming out looking like water each time, then it's considered diarrhea. If every time it came out, it looked like pellets, then it's technically constipation. So if you went 7 times a day and every time you went, it came out looking like hard rocks, you wouldn't call that diarrhea, right? So it's not just the frequency, but the character of the stool that matters. So if you had it once and it looked like water, it's still called diarrhea.
What is the best way to deal with that in terms of treatment, management, and if it's something that is caused by diet, let's say high FODMAP diet or something in those regards, what are the best things that you can do?
So, diarrhea comes from a whole lot of different reasons. If it's from a high FODMAP diet, that means that, you're having a lot of highly fermentable, non-digested sugars from foods. And these are not meant to be digested in our small bowel. So then they get to the colon where they start to produce a lot of gas, and they can really speed up the transit time when it gets there, right? And so these high FODMAP foods can certainly cause looser stools. If you're having loose stools and this is an abnormality and you had, maybe poorly cooked meat or poorly cooked street food, or you went and traveled abroad, then you should be aware that this may be because there's a virus or a bacteria that has gotten into the intestines and caused a change in the microbiome, is causing a minor enteritis, which is an inflammatory process. And that is why your body's trying to get rid of it, which is why transiently you're having loose stools. If you're getting fevers and chills from this, you should certainly go to an urgent care or emergency room where the stool sample can actually be tested to look and see if they can find parasites, bacteria, viruses, and if it can be tested for it. And if it is positive, sometimes needing a certain antibiotic can help. There are certain medications that predispose us to diarrhea as well, and we need to be aware and tell our doctors. So things like ibuprofen or Advil, okay, can certainly cause diarrhea because it caused something called microscopic colitis. Or sometimes even anti-heartburn medications, right? Things like omeprazole or pantoprazole. These are medications taken for heartburn, can also cause diarrhea in itself. And so people don't realize that they've started a new medication for something completely unrelated, but it's actually causing an irritation to the lining of the colon, and it's causing, diarrhea. And so let your doctor know if it's, outside of your norm and it's not getting better with hydration or by stopping the new thing that you've done, then certainly it's time to go seek professional help.
Do you recommend digestive enzymes to treat bloating and diarrhea at all? Or just like for any specific reason that you would say digestive enzymes are a good way to improve your digestion?
We don't need supplemental digestive enzymes because our body already makes them. That's what our body is meant for, is to make the enzymes to break down the foods that we eat, right? We already have lipase to break down certain things. And so we don't necessarily need to give it additionally in order to have them broken down. Now, there are certain sugars that are harder for us to break down, like milk, for example, right? Lactose, which is the milk, the sugar that's found in milk, we are not able to break down as easily as we get older because our lactase enzyme is going down or decreasing as we get older. So sometimes replenishing it with lactate, which is the lactase enzyme, can help process that milk. But does that mean you need to take it in order to be a normal person? No, you just have to realize that that enzyme is decreasing. Same thing, there's one called FODzyme, which is fructan hydrolase, and it helps to break down a lot of those high FODMAP sugars that are eaten by producing and giving that enzyme. But is it necessary? No, because again, our bodies have the enzymes that we need, typically, unless it is an enzyme that you're not born with, but we have all the enzymes that we need to break down the sugars that we need.
Do you need probiotics?
That's a great question, and I'll answer it this way. You need probiotic bacteria in your gut so that it can do its job of producing short-chain fatty acids so that they can help keep a healthy gut lining. Do you need to take probiotic pills and certain probiotic pills? The answer is no, because there's no one perfect probiotic pill out there for any one of us. All of us have a different microbiome. You have a different microbiome today than you will have tomorrow. I have a different microbiome today than I will tomorrow, and I have a different microbiome from you. And so there's not one pill that's a perfect set of bacteria at the perfect amount that will put us back to homeostasis or norm. And that is, the silver bullet for all of us. Is it helpful after you have had, a major infection or a dysbiosis or a change in your bacteria? It can certainly help to replenish those if you're not getting foods that have probiotic bacteria in them. but there's not one that is a perfect one out there to say, okay, if you take this one, everything will be fixed.
How does the quality of your diet affect the type of microbiome that you have in your gut? Because I hear all the time that if you have a diet that is high in ultra processed foods, very low in fiber, it's going to be feeding the quote unquote bad bacteria that is going to have a specific effect on your gut health versus eating a nutritious, highly rich in nutrients and fiber, vegetables, fruit diet that will feed other type of beneficial bacteria. So how is the quality of the food that you eat? And like mostly let's look at the overall diet because we can eat food sometimes that are not as nutritious that but still fit in your diet. But it's more so like the bigger picture. Like if it's your overall diet is not very good, how does this impact the quality of your microbiome and your gut health?
Yeah, so the what you are what you eat, right? They say that saying, but you are what you are feeding your gut microbiome. So if you're feeding it a lot of processed foods, you are actually allowing for certain bacteria to ferment and process their postbiotics, and they actually can lead for you to continually crave more of those unhealthier processed foods. So if you're eating a lot of, let's say, processed chips or snacks, those will then eventually allow for a lot of the bad bacteria to then overgrow and then lead for the brain to continuously crave those. Alternatively, if you're eating a lot of the unprocessed, minimally processed fresh fruits and vegetables, you're allowing for the healthier lactobacillus, bifidobacterium, bacillus coagulans to grow. And then these are then having you crave more of the healthy things to come back into your body. So your bacteria kind of dictate your cravings, which then dictate what you crave and want to put back into your body. So the more healthy things you eat, the more you're going to keep on eating the healthy things and more you're going to crave those healthy things. The more you eat the unhealthy processed stuff, the more your bacteria is going to crave those processed foods. And so you're going to continue a cycle of that bad bacteria, which then leads to insulin resistance, obesity, weight gain, because again, your microbiome is craving that exact thing and saying, oh, you know what? I need some more of that chocolate, or I need some more of that, that French fry or those processed chips.
How does the microbiome communicate with your appetite center to tell you, this is what I want? This is what I'm craving for.
Yeah, so the microbiome, so basically by producing those neurotransmitters, it is using those neurotransmitters to communicate with the nerves in our enteric nervous system. And the enteric nervous system is then sending those messages through the vagus nerve back to our brain to then say, hey, this is what we're craving. Hey, we're still hungry. Hey, we're not hungry, or we're not satisfied yet. If you're not producing enough GLP-1, which is that famous enzyme that a lot of people are trying to get through the weight loss drugs, if you're not producing it on its own through fiber intake, then your body is certainly constantly craving more until it hits that satiety signal, right? And until that satiety signal is provided, your body's going to continually crave, and that's going to lead to ingestion of more calories.
Oh, interesting. Now, I read something on your page about the difference between IBS and functional dyspepsia. Yeah. So what is the difference between that IBS and functional dyspepsia?
So it's really an umbrella term, right? They're both really disorders of gut-brain interaction, and they both are both functional GI disorders in the sense that when there are stressors, they can modulate the way that the nerves are perceiving GI distress and how they modulate how the nerves act. And so in functional dyspepsia, you may have more bloating and upper GI symptoms. And so you can have things like belching, bloating, abdominal distension, where you feel like you look 6 months pregnant, but there isn't anything in there. Whereas in IBS symptoms, these have to do with your lower GI symptoms and have more to do with constipation, diarrhea, and more of what's coming down from the bottom. So think about more of functional dyspepsia as your upper GI symptoms, bloating, belching, gas from up top. And IBS is more of the symptoms that are happening down below with constipation and diarrhea. And again, both are having to do with the disorder of gut to brain interaction.
Could you have both at the same time? Like
Absolutely.
having at the same time, in the same moment, having issues or symptoms in the upper and in the lower GI?
Absolutely. So I see patients all the time who have had tremendous amounts of psychological stress. And they say that, after they've had a fight or they've had, some type of marital dispute, they just see that their belly is just super bloated. It doesn't matter what they eat. They have something called visceral hypersensitivity, where as soon as they eat, their nerves in their upper GI tract are just doing something called accommodation. And they're actually causing it to distend or bloat and making all this room, even though there isn't something happening. There isn't a tumor. There isn't excess gas. It just makes you feel that way. At the same time, that same distressor is also causing a lot of cramping in the lower colon. So that same person who's got a bloated upper abdomen could also be having diarrhea as well. And that's the IBS portion. And sometimes they alternate or they can happen at the same time as well. So you can certainly have functional dyspepsia symptoms at the same time as IBS.
Is there any solution for that?
So in patients who have that, oftentimes giving them medications to treat the underlying brain disorder. So if it's the stress or if it's the anxiety. So sometimes for some people, even a medication like a TCA, which is a tricyclic antidepressant, can help calm those nerves. It can slow down the bowels. It can help with pain. So that can help modulate. It's called a neuromodulator. So by modulating the nerves that are causing the visceral reaction in your gut, you can help modulate the symptoms in the GI tract.
Over-the-counter medication that a lot of people use for mostly upper GI distress is Buscopan or Buscopan or it's kind of like an over-the-counter medication that's just like a little tiny pill that allows you to sort of like relax your upper GI, I think.
So yeah, so there's ones where peppermint oil, which is it's like IB Guard or FD Guard and or even Gaviscon, they are certainly utilized, and some studies show that they can allow for air and transit to kind of happen, so it allows for the bloating to go down, and they can be taken up to 3 times a day. Same thing with charcoal caps. Activated charcoal for some people can help to kind of absorb the excess gases and help symptomatically help relieve that bloating and distension.
Where is this gas coming from? Suddenly,
Sometimes,
like from the upper body, because I understand like from the lower body is your own microbiome producing extra gas and like the partial fermentation of certain things. But when there is like, let's say you haven't eaten anything and there's no real specific food that was partially digested, where is this gas coming from?
It's not actual gas. So it's a sensation of feeling gas. So this is exactly what we talk about is visceral hypersensitivity or abdominal hypersensitivity, where the nerves give the sensation that you're completely distended. And some people, they even have something called abdominal phrenic dyssynergia, which means that the muscles in the upper intestines just relax and they kind of bulge out and protrude. And they relax so much that you feel distended. You feel like you're 6 months pregnant, even though you haven't eaten, even though you haven't eaten something super gassy like broccoli, they still have it. And that's because the nerves are getting an abnormal signal from the brain to cause this distension. And that's where it's happening. And so there's not excess gas in there. It's a sensation of excess gas. And so that is what visceral hypersensitivity is. And so it's when people feel like they're all bloated and it's not actual excess amount of gas that's in there.
I've seen a few patients that they report that exactly the same, like there's no food that they have eaten, but they suddenly have like this increased pressure. Like if you just had a meal that you couldn't digest well. But they report that burping seems to actually help get rid of the pain and the pressure. So if it's not gas, how come burping makes it
Makes them
feel
feel better
better?
because a lot of times you have impaired transit of the gas itself that is in there, the normal amount. And by doing that act itself, they're allowing for the nerves to relax, but because they've already made accommodation, right? They've already caused the muscles in the upper abdomen to relax, right? They've already distended themselves out. So by physiologically burping and getting that air out, the nerves feel a sensation of relief. And they say, oh, yes, even though there wasn't an excess, whatever that they did burp out or whatever that they did try to expel, it gives them a sensation of relief, even though there wasn't an excess amount in the first place.
That's so interesting. I love this. Oh man. Now I have two more questions and I will promise I'll let you go. One is very interesting and is around women's periods, which is why do we see changes in our bowel habits and our bowel movements when we are close to our period or in our period? I'm suddenly like I have my regular bowel movements and suddenly I just experience a more frequent, more diarrhea type.
Yeah.
Why is this happening?
Yeah. So of course, when we think about, after ovulation, our progesterone levels are going up until, right before they drop. And that drop in progesterone tells our body, hey, we're not pregnant. It's time to have our period. Increased amount of progesterone increases what we call the noxious receptors or pain receptors in our body. And so we have a heightened sensation for pain right around the time of our period. So people who have IBS, right around that end of that luteal phase, they get that, number one. Number two, we have something called prostaglandins. So the same hormone that is released to cause contractions in our uterus to shed the lining of the uterus also causes cramping in our colon. So unfortunately, the prostaglandins aren't able to just isolate themselves to causing contractions of the uterus to let the endometrial lining out. That also leads to cramping in the colon, which then can cause diarrhea. So a lot of people get period poops, and that is very common because, again, these are the prostaglandins being released, and that's causing the uterine contractions, and it's also causing rectal contractions. It's the same reason some people even get the zaps in their bottom. They say, ooh, I feel like something is stabbing me in my rectum. And, they say zap in the booty hole. That zap in the booty hole is coming from prostaglandins, which are the things that are causing the actual cramping of the muscles in your pelvic floor, as well as the rectum in itself.
Oh man, that's so painful. I know when I'm gonna have my period when I feel that someone is like pretty much putting a nail in my butthole, like
Yep. Yep.
what's
Yep.
going on?
That is, yep, zaps in your booty hole. That is prostaglandins. And you know what? There's even a scientific term for it. It's called proctalgia fugax. Okay. Proctalgia meaning pain in your bottom, and fugax meaning blind, which means that there is no rhyme or reason for the pain in your butt. It's just happening because there's a spasm of your rectal muscles. Isn't that crazy?
Oh
Pain in your
shit.
booty hole, proctalgia fugax. There is a $10 word for it.
Do men get this at all?
They can. Proctalgia fugax can happen in men if they, again, if they have release of certain, prostaglandins as well. Again, they can have also contractions in their rectal muscles and pelvic floor muscles as well. So
But it's
certainly
not as
they can
common.
also, but it's not as common.
Okay. And my last question, thoughts on colon cleanses?
Ooh, don't do it. The colon is a self-cleaning organ. Every 90 minutes, our gut has something called migratory motility complexes, MMC. Okay, migratory motility complexes are tiny wave-like motions that occur in order to sweep the poop and the bacteria that are in there and to tell it to move along and make poop for it to come out. So naturally, our gut is cleansing all the things that are in there. You don't need to wipe it out or use anything else to shove in there, like liters of water or liters of whatever to, cleanse your colon. The colon is already self-cleansing and it has its own way to move things along. Now, if you're constipated, using fiber or a pro-motility agent can certainly help that, but we already have a mechanism in our intestines to move things along. So colon cleanses are just, recipes for danger, and it can also wipe out your gut microbiome. So all the good stuff that was in there is going to get wiped out along with that bad stuff that you're hoping to get rid of. So, there are a lot more harms than there are good. And, there are plenty of people making lots of money with colon cleanses. They seem like a great idea in theory, but in reality, you're wiping out a lot of your gut bacteria and you're predisposing yourself to a lot of complications, like excess, water can lead to really low sodium levels, electrolyte imbalances, perforation of your colon. How do you know if someone shoved 60 liters of water and it got reabsorbed or not? What if that hose that shoved that water in there, what if that water was, septic? What happens then? You're going to get an infection. It's not worth putting it in there. Your colon is already a self-cleaning organ, just like your vagina is a self-cleaning organ. You don't need to put perfume and you don't need to wash it. Just like that, you don't need to do that for your colon either.
What about detoxes?
I think the best detox that you can give is a rest for your gut. So oftentimes people, wait at least 12 to 14 hours between their last meal in the evening and their first meal in the morning. And giving that gut a rest allows for the migratory motility complexes to kind of move things along. And it allows for our insulin levels to kind of, level out. And that in itself should help to kind of reset and detox the gut.
I know that there is these usual approaches to improve and like clean your gut to reduce cancer risk, especially if you eat a very high amount of, I don't know, protein or meats. And like you hear in a lot of these different documentaries that you actually can't digest meat and how it putrefacts and spoils in your gut and lives forever in your gut, and that's why you get colon cancer. How true is this? And like, do you actually ever get something that stays in your gut forever?
So processed meats, not, certain meats, but processed meats that have been preserved in certain forms can lead to, are carcinogenic, which means it can lead to changes and mutations in, your DNA. And by altering our microbiome and altering and causing mutations in our DNA, we can increase the risk of formation of colon polyps. And the colon polyps then eventually can turn into colon cancer. So by having a high processed amount of foods, you can turn on abnormal mutations or turn on these genes to form abnormal mutations, which can then lead to the formation of precancerous and then cancerous tissue in our colons.
All right, I understand. So, but nothing stays living in your gut if you can't, quote unquote, break it down.
Correct.
Good. Now, I loved our conversation. I think it's going to be so great for people to hear all about these myth-busting points that we touched on. Is there anything that you would say your best tips for improving gut health, preserving the health of our gut as much as possible? Anything that you want to let the audience know about? Where can they find you and any further projects?
Yes. So the number one thing you can do for your gut health is to get hydrated. So drink water, exercise, walking, eat fiber every single day. You don't need a very expensive medication, diet, gym membership. Get out there, get nature, get walking, feed yourself good foods that are not processed. If you find yourself that things have changed and your GI tract is not doing well and you haven't found the answers that you're looking for, I am available for consultation. I do provide consultations nationwide and even overseas. If you go to my website, www.kumkumpatelmd.com, if you live outside of the state of California, you just click on educational visits and you can book an appointment to speak to me over Zoom, and we can talk about what's going on, and we can find solutions that you can talk to your local doctor to see if these are solutions that can help you. Or if you do live in the state of California, then you can come in to see me in person or also on telehealth as well.
You are amazing. And thank you so much for coming to the show.
Thank you so much for having me. This was an absolute blast.
Thank you so much. Have a great day.
You too.
Bye.
Bye-bye.